Did you know the lifetime risk of developing kidney stones is approximately 10 to 15%? It means around 1 in 10 people experience kidney stones in their lifetime. But what are they? What are the symptoms of kidney stones and how kidney stones can be treated? Let's talk in detail about these things. Kidney stones are actually hard deposits of minerals and salts like calcium and magnesium that form inside your kidneys. They can vary in shape and size, from tiny grains to larger stones that can cause intense pain. So what are the symptoms of kidney stones? The most important symptom in patients with kidney stone is severe pain in the lower back and sides. This is also termed as lowing pain. The pain often comes in waves and is described as colicky. The patient is unable to find a comfortable position and will keep moving due to intense pain. The second most important symptom of kidney stone is painful urination or dysuria. These stones may lead to obstruction of urine outflow, which causes local irritation and inflammation. This may lead to burning or tingling sensation while urinating. The larger the stone, the greater is the obstruction. Another important symptom of kidney stone is frequent urge to urinate. The stone which gets formed in the bladder may settle and move around, causing constant irritation of bladder wall. This mimics the sensation of needing to urinate even if the bladder's empty. This is called increased frequency of urination, which is important clinical finding in kidney stone patients. Another important finding which may be present in kidney stone patients is blood present in urine. This is called hematuria. The sharp or rough edges of stones can scratch and injure delicate linings of kidneys, ureters, bladder, or urethra. The blood may or may not be seen by naked eyes in the urine. If blood appears as pink, red, or brown in color through naked eyes, it is termed as visible hematuria. Another form is non-visible hematuria, where there is no change in color of urine, but red blood cells are seen through microscopy. Persons with kidney stone often experience nausea, vomiting, and loss of appetite. The intense pain may activate vomiting centers in the brain, leading to these kinds of symptoms. Now let's talk about the role of water in removing kidney stones. We all have heard that drinking enough water helps in removal of stones. Let's see how far is this statement true. Your kidneys are like the body's natural filtration system. They work tirelessly to remove waste and extra water from your blood, but sometimes when there's not enough water, minerals and salts can clump together, forming those kidney stones. Now here's where water comes to the rescue. Drinking plenty of water dilutes these minerals and salts, making it less likely for them to form stones in the first place. And if you already have stones, water can help flush them out of your system more effectively. So how much water should you be drinking? You should drink at least 8 to 10 glasses a day. But remember, everyone's different, and factors like your activity level, climate, and overall health play a role. Now you might be wondering, how exactly does water help? Well, staying hydrated increases urine production and flow. This helps push small stones and crystals out of your kidneys before they can grow into bigger problems. Plus, water helps prevent dehydration, which is a major risk factor for developing kidney stones. When you're dehydrated, your urine becomes more concentrated, giving minerals a better chance to bond and form stones. So what is the treatment of kidney stones? Usually stones which are smaller than 5 millimeters pass naturally through urination. However, larger stones, 7 millimeters or more, are less likely to pass naturally in urine. If remain untreated, kidney stones can cause urinary tract infections and other complications, including acute or chronic kidney failure. Treatment depends upon 2 factors: 1, type and size of stone, and 2, impact of stone on kidney. For kidney stones, which are 6 millimeters, medical treatment is often recommended, which involves increasing urine output by use of certain diuretic drugs. For 7 millimeter kidney stones that cause obstruction or UTI, surgical intervention may be necessary. For surgical treatment of 6 to 7 millimeters or larger stones, Methods used include 1 standard percutaneous nephrolithotomy, 2 mini percutaneous nephrolithotomy, 3 ureteroscopy, and 4 extracorporeal shockwave. Lithotripsy. Standard percutaneous nephrolithotomy is a high-technique, minimally invasive procedure that can be used to treat large stones, especially those larger than 25 millimeters. During surgery, the patient is under general anesthesia, experiences minimal pain, the incision is less than 1 centimeter, there is minimal kidney damage, and the hospital stay is only about 3 to 5 days. Another technique is mini percutaneous nephrolithotomy, which is similar to standard pcnl but uses smaller instruments. It is suitable for stones between 15 to 25 millimeters. This method reduces the hospital stay to 1 to 2 days and has other advantages such as minimal pain, reduced bleeding, minimal damage to kidney function, and a very small scar. Other technique is ureteroscopy, which involves using a very small telescope to access the stone and using a laser to break it into smaller pieces, and the fragmented stone pieces are suctioned out through the endoscope. Another frequently used method is extracorporeal shockwave lithotripsy, which is the most effective and gentle way of treating the stones. This uses shock waves to break up the stone, after which the stone fragments are naturally excreted through the urine. This method requires a short hospital stay of half a day and has a stone clearance rate of more than 70%. So it is said that prevention is better than cure. Preventing kidney stone formation is easier than treating them. Stay hydrated, eat a balanced diet, and keeping visiting the doctor for regular checkups frequently. Small changes can save you from big pain tomorrow. Again, prevention is always better than cure. For more informative video like this, subscribe my channel and don't forget to press the bell icon.